Let's turn our attention to another topic you're interested in, healthcare coverage. The first thing you should know is that healthcare coverage from a school employer is different than healthcare coverage available for retirees. Employers typically offer more affordable healthcare benefits as part of their overall compensation package. Once you retire, you may find that your costs are higher. SERS's coverage becomes more affordable after you become Medicare eligible. Just like your pension, healthcare coverage with us has some eligibility requirements. To be eligible for our healthcare coverage, you must have 10 years of qualified service credit. The key word is qualified. A list of qualified service is included in our healthcare guide. As with any healthcare plan, you will pay a monthly premium for your coverage. Your premium will be deducted from your monthly pension payment. Once you reach 20 years of qualified service credit, SERS helps you pay your healthcare premiums by providing a subsidy. To qualify for this subsidy, you need to be eligible for your school employer's health plan when you retire or for at least 3 of the last 5 years of your employment. To be clear, you don't have to be enrolled in your employer's coverage, you just have to be eligible for it. The longer you work, the higher subsidy you earn, which means lower premiums for you. And if you make it to 50 years, you won't pay a premium. Let's look at SERS's current healthcare premiums. Here's an example of SERS healthcare premiums for our most popular Medicare and non-Medicare plans. As you can see, the longer you work and earn service credit with SERS, the lower your premiums will be. Remember, to receive a subsidy, you also must be eligible for your school employer's healthcare coverage when you retire, or 3 out of the last 5 years. Your Medicare status also factors into your premium costs. SERS does offer health care for a retiree spouse. The premiums for spousal coverage are also based upon your service credit. While 20 years of service credit provides a premium subsidy for your health care coverage, a premium subsidy for your spouse is not provided until you reach 25 years of qualified service credit. Again, Medicare status also factors into the premium cost for your spouse. If your spouse is eligible for Medicare, the monthly premiums for coverage are lower. So what's available in our healthcare coverage? Our plans include comprehensive hospital, medical, and prescription drug coverage. You can also purchase dental and vision coverage. You have to be eligible for, but you do not have to be enrolled in one of our healthcare plans to purchase the dental or vision coverage. Your first opportunity to enroll in our coverage is at the time you retire. Of course, you may not need our healthcare coverage when you retire. Please be aware, there are only 2 other times you can enroll if you don't take our coverage when you retire. You can enroll within 90 days of becoming eligible for Medicare, or within 31 days of involuntary loss of healthcare coverage under another plan. Let's say you are covered by your spouse's employer plan. Then your spouse retires and you lose coverage under that plan. Your loss of coverage is considered involuntary and you could enroll at that time and your spouse could enroll as well. You may have a spouse who is retired with another Ohio public retirement system. You need to understand that you cannot waive SERS healthcare coverage to be covered under his or her healthcare plan. Likewise, your spouse cannot be on your healthcare coverage with SERS if he or she is eligible for coverage at another Ohio retirement system. SERS offers 2 options for those not yet eligible for Medicare. The first option is the SERS Marketplace Wraparound HRA with primary coverage through a federal or state marketplace. SERS provides reimbursement for eligible out-of-pocket expenses. The second option is a traditional plan through either Aetna or AltCare. These plans resemble employer coverage but are generally more expensive. The Member Healthcare Guide describes these options in detail. The SERS Marketplace Wraparound Health Reimbursement Arrangement, or HRA, is an option available only to plan participants who are not eligible for Medicare and who are not enrolled in Medicaid. This is how it works. First, you contact a UMR counselor to help you select a health care plan from the health insurance marketplace. The counselor will then determine whether you are eligible for a federal subsidy to help you pay your premium. After you have selected your marketplace plan, the SCRS Wraparound HRA will provide additional benefits to help you pay deductibles, copays, and other costs. There is no SCRS premium deduction for the Marketplace Wraparound HRA. SERS also offers traditional group plans, Aetna Choice POS2 and AltCare PPO, that resemble employer coverage but are generally more expensive. To enroll in the AltCare plan, you must live in a county where it is offered. The Aetna Choice plan is the only enrollment option if you are enrolling a family member in SERS's Aetna Medicare plan. Non-Medicare members who want to enroll in Aetna Choice, AltCare, or the SERS Marketplace Wraparound HRA must participate in marketplace counseling provided by UMR. Counselors from UMR will identify marketplace plans available in your county and compare premiums, costs, and benefits. If you want to enroll in a marketplace plan, UMR will assist you and notify SERS that you qualify for the HRA reimbursement. If you decide to enroll in the Aetna Choice or AltCare plan, then UMR will confirm that you have met your counseling requirement and SERS will process your enrollment. This is not required if you are enrolling a family member in SERS's Aetna Medicare plan. We just discussed coverage for people under 65. What happens when you turn 65? At 65, you are eligible for Medicare and our coverage becomes more affordable because Medicare helps pay the costs. Even if you are not 65 yet, you will want to pay attention to what's coming up. We'll start with a little bit of information on how Medicare works. Most people become eligible for Medicare when they turn age 65. Some people under 65 are eligible if they have certain disabilities or end-stage renal disease. Medicare enrollment is automatic if you are receiving a Social Security benefit prior to your 65th birthday. If not, you will need to apply for Medicare in person or online through the Social Security Administration. Be aware that Medicare charges a penalty if you do not enroll when you are first eligible. However, you can delay enrollment if you're still working and have coverage through your employer, or if you are not working but have coverage through your spouse's employer. Once the employer coverage ends, you will need to contact Social Security to enroll. There are 4 different parts to Medicare. Medicare Part A covers hospital and skilled nursing care. Almost everyone is eligible for premium-free Part A under their own work record, but some qualify based on a spouse's work record. Medicare Part B covers such things as doctor visits and outpatient services. Everyone pays a monthly premium directly to Medicare for Part B. Part C is also known as Medicare Advantage. It includes Part A and B coverage, but is run by private insurance companies who have contracts with Medicare. Medicare Part D is prescription drug coverage. These plans are run by private insurance companies and regulated by Medicare. They have a separate premium cost unless you select a Medicare Advantage plan that includes Part D coverage. After signing up for Medicare, you have to choose how to receive your Medicare benefits. Medicare Parts A and B together are often referred to as Original Medicare. You may want to purchase a supplement policy, also known as a Medigap policy, to pay costs that Original Medicare does not cover, such as deductibles, copays, and other out-of-pocket costs. If you want prescription drug coverage, you will also need to purchase a Part D plan. If you choose Original Medicare as your benefit option, you have to pay for each part. You pay a premium for Medicare Part B, a premium for your Medicare supplement plan, and a premium for your Part D prescription drug plan. Or you can purchase a Medicare Advantage or Part C plan. This is the option that SERS offers, Medicare Advantage plans with prescription drug coverage. When you choose our coverage, your Medicare Advantage or Part C premium is deducted from your monthly pension payment. In addition to providing you with your Part A and Part B coverage, the premium you pay to SERS includes prescription drug coverage, as well as extra benefits, such as a fitness center membership and a $60 quarterly over-the-counter health and wellness benefit. You must still pay the Medicare Part B premium to Medicare. This is usually deducted from your Social Security benefit or you are billed by Medicare. You can find out more information about Medicare by watching our video series, Medicare Basics. To access the videos, visit our website at ohsers.org and click on Video Center. Now that you have a better understanding of the basics of Medicare, let's discuss the Medicare coverage offered by SERS. The Aetna Medicare plan is a Medicare Advantage plan with coverage throughout the United States. Unless you are being reimbursed through another source, when you enroll in our Medicare coverage, we help you with your Part B premium by adding $45.50 to your monthly pension payment. Be aware that if you enroll in our coverage but then cancel it, the Part B reimbursement ends. As mentioned before, all of our healthcare plans include prescription drug coverage, and you do not pay a separate premium. Copays are listed in the healthcare guide. We also offer dental and vision coverage through Delta Dental of Ohio and VSP Vision Care. For this coverage, you must be eligible for our healthcare coverage, but you do not need to be enrolled. SERS has a 2-year enrollment period for dental and vision coverage. If you return to work in a public or private position and you are eligible for employer health care, you temporarily may lose eligibility for SERS's healthcare coverage while reemployed. This does not apply to individuals enrolled in Medicare Part B. For more details, please refer to the healthcare guide or contact SERS.